startup concluded, we have now turned to Blaise Jacholkowski. Please join me on stage, Blaise. So you are consultant and strategic advisor in digital health position. So you will share with us your perspective on health, on the future, on the strategies, right?
Yes, that's correct, Lady.
Thank you.
Thank you very much. So I still hope, good evening everyone, I still hope you have some attention left for me. It's almost over, don't worry. So I'm gonna try to respect my time. We have 10 minutes ahead. So I'm gonna walk you through my presentation, which is about addressing the actionability gap in healthcare, which was mentioned earlier by Professor Gottardo. So we live in an era of very abundant data. Basically, we have too much data and a lot of health data. So we really feel like we are kind of drowning into that data. And it's growing exponentially every year. So first I would like to ask you actually, who in the room has a health tracker? Please raise your hand. So yeah, almost everyone. I think everyone actually should raise their hands because if you have a smartphone, you do have a health tracker if you haven't disabled that feature. So every one of you is basically generating about 10 megabytes of data every day. So and this is even not actually the raw data. This is the data. The raw data is the data captured by your sensors, but this is the transfer data for each of you. And in the room, as we are close to 100 people, it's several gigabytes basically of data every day. So that's a lot. But to give you even a bigger perspective, if we look at hospitals generated just for imaging in 1 year about 50 exabytes of data. So exabyte is 10 power 18. So that's an enormous number. But even bigger, if you look at the total healthcare data, and of course this is just an estimate, we're talking here about zettabytes of data, so 10 power 21 bytes. So we're definitely not lacking health data. So you might have seen already this pyramid before. So this is actually a hierarchical representation of data to insights. So each layer is building on top of the other one. And so at the foundation, you have the data, of course. And then if you organize this data, you get information. But as we know from people such as Harari, most of the information actually is junk, so not very useful. So what you need to do is to put this information into context. So once you do that, you get some knowledge and you get access to meaning. And then even better, if you now add some purpose to this data, you get, or to this knowledge, then you get insights which are actionable and that we are looking for. Unfortunately, we don't get enough of it. Another representation that you might have seen already is this one, where you have a fifth layer which has been added that which is called wisdom. So wisdom is really about connecting the dots between different insights. So once you have several insights which connect together, then you can make, for example, a medical recommendation. So this is actually the ultimate goal. So we have too much data and not enough insights, as we said. So there's a big impact on both clinicians and individual users. And this actionability gap affects clinicians by increasing their cognitive burden or cognitive load, and it's impeding timely decision making. For individuals, it limits the ability to leverage personal health data to manage their own health effectively. So we should do something about it. But first, I would like to tell you a bit about Kahneman's concept of noise in judgment. So you might have all heard of Daniel Kahneman. He's a Nobel Prize winner in economy. He won it in 2002. And he wrote a book a few years ago, I don't know if you heard of it, called Noise. Human Flow in Judgment is the subtitle. And Daniel Kahneman, in one of the chapters of the book, talks about noise in medicine. And he says medicine is very noisy. So that's important to know. So the error is actually the sum of a square of a bias and the square of noise. So we talk a lot about bias with algorithms, and rightly so. But we don't talk so often about noise. And this is why I'm mentioning it today here, because I believe, and Daniel Kahneman believes it's important in medicine. So bias, as a definition, it's the systematic error in judgment. So in mathematical terms, it's the average deviation from the true value. And you can see a representation here on the arrows, what it means visually. Whereas noise is a random unwanted variability in identical judgment. And it's a big flow in humans' judgment, actually. This noise is actually prevalent across all disciplines in medicine, especially in clinical diagnosis. So Kahneman talks about many examples that I'm going to tell you a bit more about. And clinical diagnosis is actually suffering from a higher noise than we think, despite medical guidelines. And the consequence is that inter-specialist agreement is pretty low. And what explains this mostly is variation in skill. Of course, some doctors are more skilled than others, so it influences their decision. So an extreme case is actually psychiatry. If you look at one study actually about depression, the level of agreement between specialists was only 15 or less than 15%, so extremely low. But even if you look at cancer screening, and we spoke about cancer screening a bit earlier today, if you go to a doctor, you have much more chances to get a cancer screening in the morning than late afternoon. So better go see the doctor early morning. You have more chances to have a better diagnosis. But the same applies to pathologists, for example. So pathologists analyzing skin lesions were in agreement only 62% of the time in that study. And cardiologists analyzing angiograms were only in agreement 69% of the times. So we see that across the board. So are algorithms the solution? And why do I ask this question? It's because algorithms suffer from bias, as you know, but have a low level of noise versus humans. Ideally, actually, machine learning algorithms are deterministic. So they shouldn't have any noise in the ideal world. So if you give the same inputs to a given model, you should have the same output. Of course, in practice, it doesn't work exactly this way. There's variability in training data and randomness, which introduces noise. And there are different types of noise. I don't have time to describe them in details here for you, but just for you to know, there's level, pattern, occasion, system noise. But all of them can be actually addressed. Also, the question, more data, the better, not really. What matters more is the quality of the data. So if you have bad quality data, of course, this can lead to a wrong output. And there's always this question, can you trust health data coming from non-medical grade devices? And last but not least, Gen AI, by definition, is noisy. It's a kind of black box. So how now do you generate insights for the users? So I'm going to show you a framework which is commonly used in the world of healthcare technology. So on the one hand, you have what we call the so-called systems of record, so where data is generated. So of course, you have a lot of data coming from interactions between the patients and the doctors. You have all these databases with omics data, genomics, and the likes. You have all the data coming from the devices, medical IoT, wearables monitors. And you have also other types of data, third-party data or marketing data, for example. On the other side of the spectrum, you have the system, what we call the systems of engagement. So where data is presented to the users. And the goal is to present the right data to the right user. So there you have many collaboration systems. You have clinician portals, EHRs. You have patient portals as well as mobile apps and dashboards. So now the question is, what do you put in between? So typically, you need something what we call a digital health platform. So this is a very conceptual framework that I'm showing you today without entering into any technical details. But you can see the data flow. So usually data is first generated, of course, but then it's ingested, it's persistent, it's enriched, and then it's presented. So there's a lot of steps in between. And the first big step is the cleaning of the data. So you need to do some data adaptation. And as you can see here, the center of this platform is the API for FHIR. So FHIR is the main standard today which ensures interoperability. So now almost all the platforms are adopting this standard. So you need to convert all the standards into FHIR. You need to do some data normalization. You need to do some data annotation. So quite boring stuff, I would say, but which are required. And you need to label sometimes some data to make sure that it's properly interpreted. And after that, you can do some analytics, but only once the data has been cleaned properly. And then you can use insight services, create a data lake, and do some machine learning, for example. And at the bottom, you can see this layer, which is a security layer, which ensures proper identity management, audit logs, and traceability. That's very important if you're building medical devices. So I'll just give you a few examples here of these digital health platforms. So these are among the top 5 leading providers. You can see 3 of them are the largest medtech players, Siemens, Philips, and GE Healthcare, for a good reason, because these companies, they commercialize a lot of huge devices, and most of these devices are connected and are generating a lot of data. So it made sense for them to have their own platform. Then you have, of course, Microsoft, who's a leading cloud provider, and they have designed a cloud specifically for healthcare. And then you have a smaller player like Bright Insight, for example, which is focusing on software as a medical device. So with that, if healthcare practitioners don't have enough insights, is it because of a technological issue? And the answer, obviously, is no. The main challenge is to deliver the right insights at the right time to the right user. And there are often issues integrating them in their workflows, which creates disruptions. And no healthcare practitioners likes to be disrupted in their workflow. And what I would like to add also, which is very important, that today you have a proliferation of digital health solutions. So a lot of entrepreneurs come and they identify a problem and they try to solve it, which is great. But if you don't have a connection between these solutions, if you don't have the right infrastructure, and we're going to talk about that in a minute, if you don't think in terms of ecosystem, then it's not going to be adopted. So this is my main advice to startup entrepreneurs here today, is to be able to think more in terms of ecosystems. Right, so thank you very much for your attention, and let's stay in touch.
Thank you so much, Blaise. It's really